Hello, Samai. I'm Hugh from A1 Eyewear in Wrexham, and in this Gofal Golwg or sight care series, I want to discuss various eye health topics. Today, I want to talk about dry eye. So, not the most exciting of conditions or topics, so I'll try and keep this fairly brief if I can. Nonetheless, it is a condition or problem that affects more and more people, especially as we get older, unfortunately, and does cause a degree of frustration, annoyance on a daily basis, and can, in some cases, actually get people down. So it's an important topic to discuss. So if you bear with me with the technology, I'll just share my screen here. So, dry eye. If I was to Google dry eye or symptoms of dry eye, we'd see a whole host of symptoms. Some of them you see on the screen here. So sore eyes, gritty eyes, burning eyes, red eyes, stabbing pain is a common one. Occasionally blurred vision as well. So if you're struggling with any of these, or if you know of anyone struggling with these symptoms, then there's a strong possibility that you're struggling with some form of dry eye. So I'll try and stick to what you need to know and what you need to do, so you take some pointers from this presentation. Majority of dry eye cases tend to be poor quality of tears rather than lack of volume, which I'll explain, hopefully explain in simple terms in a second. So in most cases, your gland is producing the tears. The tears are just evaporating off the surface of the eye quicker than what they should, which results then in a dry front surface of the eye. The good news about this is there are things we can do to help to try and keep the tear film staying on the surface of the eye for longer. So here is a quick diagram of the tear film. So the main tear volume is the aqueous layer that you see here, and then covering that, then you've got the lipid layer. You can think of it as an oily layer over your tear film, and usually in most cases with dry eye patients, it's the lipid layer we need to concentrate on. So if there's lack of oil covering the tear film, what we often find, and this is due to a condition called blepharitis affecting the lids and lashes. Not we necessarily need to go into that in today's sort of presentation. But what we find is that the glands here, so there's about 20 of these on the upper lid, 20 on the lower lid. These glands that let the oil into your tears, if you like, as we blink, are getting blocked up, are getting clogged up. So not the nicest picture coming up here, but if I'm squeezing your lids in the eye test gently, I promise, then we often see this sort of yellowy, thick discharge coming from the lids. That means that too much of the oily layer, if you like, is stuck in the lids rather than being in the tear film where it should be. So the first thing to do, in my opinion, in treating dry eye, if we can, is to unblock these glands. And simply by doing that, which we'll explain now, you may get some relief from your symptoms. So the only way to unblock the sort of thick discharge block glands here is to heat the lids up. So you can heat the lid up with a hot flannel, although don't generally advise that nowadays because it tends to cool down quite quickly and therefore not really that effective. So what you see on the screen here is a couple of different eye bags that are kind of fairly reasonable to purchase. You pop them in a microwave for a few seconds and it should retain the heat for a good 2, 3, 4 minutes ideally. So you need to heat the lid up. So it's an excuse to close your eyes for 5 minutes and relax, but heat the lid up as much as possible for, say, 3 or 4 minutes, followed by then gently pinching or massaging the lids, should then get some of the discharge here released. But do need to be doing this on a regular basis for good 2 to 3 weeks hopefully, to get real benefit. Going back to this picture, you'll also see some sort of flaky dandruff-like deposit on the lashes here, which you may experience first thing in the morning when you wake up in the corner of the eye and so on. So for that, accompanying the eye bag, I often advise the lid cleaning wipes called Clean here. Lots of people who use these find them quite soothing to use even after using it once, but again, ideally done daily for a couple of weeks, and you'll find real benefit. So I should say there are other wipes. These are the ones we tend to advise here and tend to be well received. After that, then the third point is eye drops. So I think the mistake that, of course, most people naturally do if they are suffering with dry eye is to go straight into this point here, point number 3, which is drops, which isn't really curing the problem or tackling the root cause, in my opinion. It's just sort of masking or covering up the problem. But nonetheless, it's useful to have the drops to use as and when required during the day. But I would stress and I try and emphasize to try and be thorough with point 1 and 2 first. So unblock the glands, clean the lids and lashes. That should help. Hopefully you won't need to use the drops as often then. But if you do need drops, preservative-free is definitely recommended. So we generally advise and sell the Talos Duo on the left here, but there are plenty of other preservative-free ones. Like Kusan here is another example. The cheaper drops, if you like, generally do have preservatives, and we don't want to be putting unwanted chemicals on the eye if we can avoid it. So. Yeah, so to summarize, if you concentrate on those 3 things as a starter, as a base, that should definitely help your symptoms. So unblock the glands, clean the lids and lashes with preservative-free wipe and preservative-free drops. Each case is obviously different, so I should officially here advise having this checked over by ourselves or your local optician. So if you've got any queries, please comment below or feel free to contact us. I'm more than happy to chat to you, whether you're local to us or not. And there's lots more then that can be covered once you've done this for 2 or 3 weeks in terms of your environment, diet, fluid intake and so on. But I think this is the basics that I think everyone would benefit from. So yeah, hopefully found that useful. Like I said, if we can help with anything, please get in touch, and yeah, we'll see you again soon. Okay, diolch yn fawr. Ta-ra.